So let's walk through an example that's in your homework, okay, for an E&M example. So we have Zena, 50-year-old female, sees Dr. London for the first time. Boom, right there, we know, new patient, okay? Because we know we have to know, first of all, where they are and if they're new or established. So we know they're new, okay? Even though it doesn't specifically say in the office, okay, I know you don't ever assume in coding, but for the purposes of your homework, based on the way this reads, it looks like Dr. London saw her in the office. So we're going to go with office visit, new patient, okay? So we've got 5 years ago, diabetes, and diabetes has resulted in eye problems, renal problems, okay? She's got heart disease, episodes of CHF, peripheral vascular disease has worsened. She can only go a block before she's crippled with leg pain, okay? So now we have a new problem, okay? We've got throbbing headaches, radiating neck pain, okay? So just think if you had to code the diagnosis for this case. We'd have a lot, right? So Dr. London talks with the patients about her health concerns issues. In order to investigate the multiplicity of problems, the doctor has to take a complete past family social history, a complete review of systems, and a medically appropriate exam, okay? So doctor has to take in a multitude of factors into consideration as the patient's problems are highly complex. All right. So where do you start? Now for E&M, you can start in the back. So if you turn to page 1037 in your CPT book and look up evaluation and management, okay, and we know the patient's in the office, okay, and we know they're new, so we're going to get a range between 99202 and 99205. Okay, we can do it that way. However, we can also go to the tables that we talked about in the first video that are on page XXV, right after the illustrations, and right before your E&M table of contents. Okay, and we can look at the table here. Okay, now we're going to verify it in the code description. Okay, so we said in the office, new patient. So if we go to the top left corner, we have office and other outpatient new. Okay, so we know it's that table. So we've talked about the history and the exam, medically appropriate. Okay, so we're really looking at the decision making. So in the case, it says patient has a lot of factors to consider and the patient's problems are highly complex. Okay, so I would say we can't do time because there's no time documented here. So we can't find our level based on time. So we're going to have to base it on decision making. Okay, so I would say because she's got diabetes, eye problems, renal problems, heart problems, vascular problems, now she's got a new problem. Okay, we're probably going to look at complex. Okay, is what my first inclination is. Okay, so now I want you to flip over to that table that I told you about on page 16. Okay, so we know it's new. We know we've got a new patient. So let's look at the definition of complex decision making on page 17. Okay, so we've got one or more chronic illnesses with severe exacerbation. All right, so I would say diabetes is a chronic illness, and she's got eye and renal problems due to that. Okay. She's still got heart disease, so that's another chronic problem. Okay, she's got vascular disease. That's another chronic problem. Okay. And then the other option, if you see on 17, it says acute or chronic illness or injury that poses a threat to life or bodily function. I would say heart disease poses a threat. Okay, and I know I'm kind of making a little bit of a judgment here. And you're right, I'm not a medical doctor, okay? And so you think about it, so let's look at the problems to be addressed. So I think that still qualifies as a 205, okay? Then look at the data. So external notes, because so it says first time, so he may have gotten the notes for the first time, we don't know. It doesn't really say that he did a bunch of tests, okay? It does say that he did a complete history and a complete review of systems because it's the first time he's seen her, okay? And then look at the last part where it says risk of complications, okay? So think about, he's got a lot of diagnosis to deal with. He's got complex data, okay? So I'm going to say this is probably a 205. So let's look at what Connect says. All right. So this is one where you're going to have to do the drop down. So where do you look in the manual? You look in the alphabetical index, because that's where they always want you to start. And I agree with that. You would always start in the index. E&M's a little bit different, okay? E&M, we're going to do office, okay? We know they're new. And so your options are only going to be a medically appropriate history, medically appropriate exam. Decision making, we said it's high complexity, okay? We know that they have diabetes, plus a lot of other things, okay? So we did verify it. Is there a symbol? So we need to flip to page 19, which is the actual code description of 99205. Okay, so the star, if you look at the bottom of pages 18 and 19, that legend is on every single page of your CPT book. The star means that you can do that. That can be done. That service can be offered through telemedicine. Okay, there's another, the triangle means that the code's been revised because all the E&M codes were revised because it used to be you chose your level based on the level of history, exam, and decision making. Now it's all decision making, okay? We don't really need a modifier because there isn't anything unusual about this other than it's just a high complexity case, okay? We looked at the guidelines because we looked at the pages 16 and 17, okay? And so we're going to get a 99205. Okay? So let's go through another example. Okay, so this is a critical care case. It's pretty straightforward because it says, doctor spent 2.5 hours administering critical care services and evaluating Carolina upon her admission to the ICU. Okay, so it says critical care. You can go to the back and look up evaluation and management, critical care, okay? But turn to the critical care section, which is on page, starts on page 31. Okay, so I told you in the last video, or in the chapter video, that critical care is always on time, okay? So 2.5 hours, so flip over to page 32. So you'll see that table is listed in minutes. So we got to convert this to minutes. So we got 60 minutes, an hour. So 2 times 60 is 120, plus a half hour is 30. It's 150 minutes. So we got to find a code for 150 minutes. Okay? So look at the table. 150 minutes is going to be a 99291. And a 99292 times 3 units, okay? A 99291 is always only going to be 1 unit, and you don't have to put the times 1, okay? So you're going to put a 99291 And then your second code is going to be a 99292 times 3. So you're going to express that like this. Okay? Because this is your first code, this is an add-on. But because those are your only two codes, you have to do multiple units of this one to get the appropriate reimbursement and the appropriate code for the amount of time the physician spent in the critical care. Okay, so there's just a couple of examples in E&M. Please continue to post your questions to the discussion board. I know this is not going to be easy, so don't pull your hair out. Just try it, and when you have questions, post to the discussion board, help each other. Okay?